In diagnostic radiography, what is the primary purpose of increasing the kilovoltage peak, kVp, during an X-ray exposure? A. To increase image contrast. B. To reduce photon penetration. C. To increase X-ray beam penetration through tissue. D. To eliminate scatter radiation. Answer, C. Kilovoltage peak, kVp, controls the energy and penetrating ability of the X-ray beam. Increasing kVp allows photons to pass through denser body structures more effectively, which is especially important when imaging thicker anatomical regions. However, higher kVp can also reduce image contrast and increase scatter radiation. Radiologic technologists must balance kVp carefully to achieve optimal image quality while minimizing patient exposure. What is the primary function of a radiographic grid? A. Increase X-ray beam intensity. B. Reduce scatter radiation reaching the image receptor. C. Increase exposure time. D. Improve patient positioning. Answer, B. A radiographic grid is designed to absorb scatter radiation before it reaches the image receptor. Scatter radiation reduces image contrast and degrades diagnostic quality. The grid contains lead strips that block scattered photons while allowing primary radiation to pass through. Although grids improve image quality, they also require increased exposure factors, which must be carefully managed to avoid unnecessary radiation dose. Which tissue type absorbs the greatest amount of X-ray radiation? A. Muscle. B. Fat. C. Bone. D. Air. Answer, C. Bone absorbs more X-ray radiation than most other tissues because it contains calcium and has a higher atomic number and density. This greater absorption results in bones appearing white or radiopaque on radiographic images. Understanding differences in tissue absorption helps technologists adjust exposure factors appropriately for various anatomical structures. What is the main purpose of collimation in radiography? A. Increase radiation exposure to the patient. B. Limit the size and shape of the X-ray beam. C. Reduce exposure time. D. Improve film processing speed. Answer, B. Collimation restricts the size and shape of the X-ray beam to the area of clinical interest. This reduces patient radiation exposure and decreases the production of scatter radiation, which improves image contrast. Proper collimation is an essential radiation protection practice and a professional responsibility of radiologic technologists. Which imaging factor primarily controls radiographic density, overall image darkness? A. Exposure time and tube current, MOS. B. Source-to-image distance. C. Grid ratio. D. Beam filtration. Answer, A. Milliampereseconds, MOS, which is the product of tube current, MA, and exposure time, directly controls the quantity of X-ray photons produced. Increasing MOS increases the number of photons reaching the image receptor, resulting in a darker image. Proper adjustment of MOS ensures sufficient image density while minimizing patient dose. What is the primary biological effect of ionizing radiation on human tissue? A. Immediate bone fracture. B. Chemical changes in cellular molecules. C. Increased blood circulation. D. Instant tissue regeneration. Answer, B. Ionizing radiation interacts with atoms and molecules within cells, causing ionization and chemical changes. These changes may damage DNA or other cellular components, potentially leading to cell death, mutation, or cancer over time. Understanding these effects highlights the importance of radiation protection principles such as ALARA, as low as reasonably achievable. Which principle is most important for minimizing radiation exposure to patients and staff? A. Increasing beam intensity. B. Reducing filtration. C. Applying ALARA principles. D. Increasing exposure time. Answer, C. The ALARA principle emphasizes keeping radiation exposure as low as reasonably achievable while still obtaining diagnostic images. This involves proper technique selection, shielding, collimation, and minimizing repeat exposures. Radiologic technologists must consistently apply ALARA to protect both patients and healthcare workers from unnecessary radiation risks. What is the primary purpose of lead shielding during radiographic procedures? A. Improve image contrast. B. Protect radiosensitive organs from radiation. C. Increase beam penetration. D. Reduce equipment temperature. Answer, B. Lead shielding protects sensitive organs such as the thyroid, gonads, and breast tissue from unnecessary radiation exposure. Lead effectively absorbs X-ray photons due to its high atomic number and density. Proper shielding is a key radiation safety practice in diagnostic imaging. Which factor most directly affects image contrast in radiography? A. Kilovoltage peak, kVp. B. Exposure time. C. Grid frequency. D. Tube current. Answer, A. Kilovoltage peak, kVp, significantly influences radiographic contrast. Lower kVp produces higher contrast images with more distinct differences between tissues, while higher kVp produces lower contrast images with more shades of gray. Selecting appropriate kVp levels is crucial for visualizing different anatomical structures clearly. What is the function of beam filtration in an X-ray system? A. Increase radiation dose. B. Remove low-energy X-ray photons. C. Shorten exposure time. D. Improve patient positioning. Answer, B. Beam filtration removes low-energy photons that would otherwise be absorbed by the patient without contributing to image formation. By filtering out these photons, the overall radiation dose to the patient is reduced while maintaining useful beam quality. Aluminum filters are commonly used in diagnostic radiography systems. What is the main purpose of the image receptor in radiography? A. Generate radiation. B. Capture and record the X-ray image. C. Control beam intensity. D. Adjust patient positioning. Answer, B. The image receptor captures X-ray photons that pass through the patient and converts them into a visible image. In modern radiography, digital detectors often replace traditional film systems, providing faster image processing and improved image manipulation capabilities. Which organ system is most sensitive to radiation exposure? A. Nervous system. B. Digestive system. C. Reproductive system. D. Skeletal system. Answer, C. Reproductive organs are highly radiosensitive because radiation can damage rapidly dividing reproductive cells. Exposure may affect fertility or cause genetic mutations that could be passed to future generations. This is why gonadal shielding is often used when imaging areas near reproductive organs. What is the main advantage of digital radiography compared to traditional film radiography? A. Higher patient radiation dose. B. Faster image acquisition and processing. C. Lower image resolution. D. Limited image storage. Answer, B. Digital radiography systems allow rapid image acquisition and processing, reducing waiting times and improving workflow efficiency. Images can be enhanced, stored electronically, and shared easily with other healthcare professionals, which improves diagnostic capabilities and patient care. Which factor increases scatter radiation production during an X-ray exposure? A. Lower kVp. B. Higher kVp. C. Reduced field size. D. Increased filtration. Answer, B. Higher kVp increases the energy of the X-ray beam and the likelihood of scatter radiation through interactions such as Compton scattering. Increased scatter reduces image contrast, which is why grids and proper collimation are used to minimize its impact on image quality. What is the primary role of a radiologic technologist during imaging procedures? A. Diagnose diseases directly. B. Operate imaging equipment and ensure patient safety. C. Prescribe medications. D. Perform surgical procedures. Answer, B. Radiologic technologists are responsible for operating imaging equipment, positioning patients correctly, selecting appropriate exposure factors, and ensuring radiation safety. While they do not diagnose diseases, their technical skills and knowledge are critical for producing high-quality images that physicians rely on for diagnosis. Which positioning error can cause anatomical distortion on a radiograph? A. Correct alignment of central ray. B. Improper patient positioning. C. Proper source-to-image distance. D. Correct exposure factors. Answer, B. Improper patient positioning can cause structures to appear distorted, rotated, or misrepresented on radiographic images. Accurate positioning ensures that anatomical relationships are displayed correctly, allowing physicians to interpret images accurately for diagnosis. What is the main purpose of maintaining proper source-to-image distance, SID? A. Control image magnification and sharpness. B. Increase patient radiation dose. C. Improve patient comfort. D. Reduce equipment weight. Answer, A. Source-to-image distance affects image magnification and spatial resolution. A greater SID generally reduces magnification and improves image sharpness. Radiologic technologists must select appropriate SID values to maintain consistent and accurate imaging results. Which radiation protection device monitors occupational exposure over time? A. Lead apron. B. Dosimeter badge. C. Grid device. D. Collimator. Answer, B. A dosimeter badge measures cumulative radiation exposure received by healthcare workers over a specific period. Monitoring exposure levels helps ensure that occupational radiation doses remain within safe regulatory limits. This practice protects radiology staff from long-term radiation risks. What is the primary cause of motion blur in radiographic images? A. High kVp. B. Increased filtration. C. Patient movement during exposure. D. Low grid ratio. Answer, C. Motion blur occurs when the patient moves during the X-ray exposure. Even slight movement can reduce image sharpness and make anatomical details difficult to evaluate. Technologists minimize motion by using short exposure times and providing clear instructions to patients. Why is proper patient identification essential before performing a radiographic exam? A. To reduce equipment cost. B. To ensure the correct procedure is performed on the correct patient. C. To shorten exposure time. D. To increase beam intensity. Answer, B. Accurate patient identification ensures that the correct imaging procedure is performed for the intended patient. Errors in identification can lead to unnecessary radiation exposure, incorrect diagnoses, and serious patient safety incidents. Following proper verification protocols is a critical step in healthcare practice. During a radiographic examination, a technologist notices excessive scatter radiation reducing image contrast. Which adjustment would most effectively improve image quality? A. Increase field size. B. Increase kVp significantly. C. Use proper collimation to reduce the beam area. D. Remove the grid from the system. Answer, C. Scatter radiation occurs when X-ray photons interact with tissues and change direction before reaching the image receptor. This scattered radiation reduces image contrast and clarity. Proper collimation limits the size of the X-ray beam to the area of interest, reducing the amount of scatter produced. By minimizing unnecessary radiation exposure to surrounding tissues, collimation improves image contrast and supports radiation protection principles. Which factor most directly influences spatial resolution in radiographic imaging? A. Focal spot size. B. Patient age. C. Room temperature. D. Beam filtration. Answer, A. Spatial resolution refers to the ability of an imaging system to distinguish small objects that are close together. A smaller focal spot produces sharper images because the X-ray beam originates from a more precise point. A large focal spot increases geometric blur, which reduces image sharpness. Radiologic technologists must select appropriate focal spot sizes depending on the imaging procedure and exposure requirements. Which interaction between X-ray photons and matter is primarily responsible for scatter radiation in diagnostic imaging? A. Photoelectric effect. B. Pair production. C. Compton scattering. D. Coherent absorption. Answer, C. Compton scattering occurs when an X-ray photon interacts with an outer shell electron, causing the photon to change direction and lose energy. This interaction produces scattered radiation that may reach the image receptor from various angles, reducing image contrast. Compton scatter is the dominant interaction in diagnostic radiography, particularly at typical X-ray energies used in medical imaging. When imaging a thick body part, why might a technologist increase MOS instead of KVP? A. To improve image brightness without increasing penetration excessively. B. To reduce patient dose completely. C. To eliminate scatter radiation. D. To reduce exposure time automatically. Answer, A. Increasing MOS increases the number of X-ray photons produced without significantly changing their energy. This helps ensure adequate image receptor exposure when imaging thick anatomical regions. Increasing KVP excessively would increase beam penetration, but reduce image contrast and increase scatter radiation. Technologists often adjust MOS first to maintain diagnostic image quality. Which anatomical structure contains air and therefore appears darkest on a radiograph? A. Liver. B. Lung fields. C. Bone marrow. D. Muscle tissue. Answer, B. Air absorbs very little X-ray radiation, allowing most photons to pass through to the image receptor. As a result, air-filled structures such as the lungs appear dark or radiolucent on radiographic images. Understanding differences in tissue density allows technologists to interpret radiographic images correctly and adjust exposure factors accordingly.